What is obstructive sleep apnea? I'm going to start with the definition and then I'll break it down so that we can all understand. My name is Dr. Joy. I'm a dentist who helps patients sleep better with oral appliance therapy. Obstructive sleep apnea is the total or partial collapse and opening of the upper airway while asleep. Opening of the airway is almost always paired with an awakening from the sleep. Some risk factors include neck circumference. So when we measure around the neck here, for women, larger than 16 inches is a risk factor, and for men, more than 17. Retrognathia. That just means that the lower jaw is positioned further back than we would like it to be. Large tonsils. That means when you look in the back of your throat, you see the tonsils back there, and they're in the airway, in the space that we want to see open for breathing. A narrow airway resulting from a V-shaped hard palate. So how does this affect the body? It results in fragmented sleep, which means we are not able to get a full night's sleep. It's being broken up because we're falling asleep, we're choking a little bit, we're waking up. The body's doing its very best to keep you alive by waking you up to make sure you are breathing. This often results in a lowered amount of total sleep time, which means we also have less time for restorative sleep, so we're just not getting it. It also lowers the total amount of time we have in REM. And REM is a stage of sleep. That's when we regulate our mood and memory and just categorizing the things that have happened during the day. And the last result is on the cardiovascular system. So think about your heart. So when we stop breathing, it often results in the oxygen levels in our blood and our body dropping. So the cardiovascular system, your heart, it's trying to make up for all of this, and so it increases stress on the heart. Some signs and symptoms of obstructive sleep apnea are daytime sleepiness, trouble with memory or concentration, gastroesophageal reflux, also known as GERD, behavioral issues including irritability or depression, chronic fatigue, waking up with a dry mouth or sore throat, early morning headache, heavy snoring, nighttime sweating, and insomnia. Just meaning you're not able to sleep well. The last thing I'll talk about today are some treatment options. Now, every patient is different and it will be up to you and your doctor to figure out what's going to work best for you. But here are some of what is available. CPAP, oral appliances, weight loss surgery, hypoglossal nerve stimulation, also known as Inspire, positional therapy, which just means we elevate your head so that your jaw doesn't fall back and your tongue doesn't fall back into your airway while you sleep. And lastly, GLP-1 injections, also known as Zepbound. Now this is a lot of information. I hope y'all learned something today with me. If you have more questions about sleep apnea, please leave them below. I'll see y'all in the next video. Bye!